everyone. Good evening. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm hoping that all of you must be doing really good. Today, we are going to discuss about our skin health with focus on urticaria or hives, which are quite common. Today, as you all know, in this digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online and understand what is urticaria, what are the types, etc. It's always good. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Chanchal Bhar, who is joining us from Kolkata. Yeah, he's MBBS, PGDM, DVT, PhD. He has many years of experience in this field. He's the founder of Nebula Skin Clinic, which is located at North Kolkata. He is also the visiting faculty at Manipal Dhakuria Hospital, Apollo Clinic, etc. It's such a pleasure to have you with us, sir. A very warm welcome to you.
Thank you.
Doctor, to
Thank you for
start
the
with,
kind words.
pleasure, doctor. So, doctor, to start with, what is urticaria?
Yeah, what is Urticaria? Urticaria in Bengali we call it as Ambat. What happens? Urticaria is actually a skin disease, allergic skin disorder. Simply allergic skin disorder, which may be intrinsic or may be extrinsic due to some other agents, maybe
Hmm.
food, maybe inhalants, etc., which causes intense itching on the skin. There may be swelling, there may be redness, and it may be associated with fever also sometimes. That is actually called urticaria.
Doctor, as you said, it's an allergic reaction. What can trigger it? What all can lead to urticaria?
There are many things which can trigger urticaria, na?
Okay,
Including tight clothing. Hmm. Uh,
okay.
Nowadays, we are having mainly terylene terracotta clothes. They also can create this exercise. That also can cause sometimes urticaria. That is called physical urticaria. Another type of urticaria. Cold water, very cold water, ice,
Hmm.
they can cause urticaria. Many types of foods are there. They sometimes we call them as allergic foods like uh, what is the egg,
Hmm.
variously we say. Uh, many types of things, including tomato. Sometimes we can see that we eat maida that can also cause that urticaria. Not itself, but actually the ingredients by which they are prepared or by the insecticides, chemical insecticides, which can precipitate this type of urticaria. Not only that, anxiety is also a very good cause of urticaria. Various
Okay.
types of dyes we are used, that is also a cause of urticaria,
Uh,
and sometimes it is intrinsic. That means it's an autoimmune disease. They all can cause urticaria. That can trigger the
uh,
factor, triggering factor.
a lot many things can trigger
Lot
urticaria.
many things can trigger urticaria. Lot many things, including tight clothes.
Right. Now, doctor, is urticaria a serious condition?
Urticaria, if it is associated with respiratory distress, that means
Okay.
respiratory distress.
Breathing issues.
Absolutely. That is very serious. That is very serious, and that condition should be treated immediately in a hospital setting. That is
Okay.
really serious.
Okay.
Otherwise, it it is not life threatening, but it's a cumbersome disease. Patient always itches, and that causes all types of bogus things in his or her life. Na? Suppose
Right.
he or she has gone to a work and there he starts itching. It will hamper the work and everything. Mental condition of the patient gets broken daily by itching. All these things will affect the psyche of the patient. Na?
Absolutely. That hampers the lifestyle, the life quality, and of
Yeah,
course, it's very
life
annoying.
quality index gets lower. Life
Ah,
quality
right.
index gets lower because it is a, It's a chronic disease actually. Actually, it's a chronic disease, and you don't know when it will happen and what thing will happen. It what thing will trigger this urticaria. You don't know actually.
Right.
That is very
Doctor,
difficult to
yeah,
identify.
fair enough. Now, doctor, what are the various types of urticaria? If you can shed some light over that. We have heard it's acute and
Main,
it's chronic.
yeah. Sometimes it is acute. Acute urticaria, you can understand that it may be due to some food. Suddenly you have taken some prawn and you are getting, your lips are getting swollen, your eyes starts itching, and you are getting various types of itching, redness, swelling of any part of the body. That is one type of acute urticaria.
Okay.
In lateral life, you may not get it if you don't take that type of prawn.
Hmm.
But the main thing is chronic urticaria. It may be due to many things, and mainly they are due to the intrinsic factors. Huh? This chronic urticaria, these are the main two types of urticaria, acute and chronic. There are other types of, it may be physical urticaria, what I told,
Hmm.
tight clothing, ice, cold water, cold weather, all this can precipitate urticaria.
Hmm.
These are the various factors are there. But mainly
So,
these
what
two
is the
types, acute
basic
and
difference between
chronic.
acute and chronic, doctor? What is the basic
Acute
difference between acute and chronic urticaria?
Acute urticaria is usually due to the food or some extrinsic agent, due to some
Okay.
extrinsic agent outside
Huh.
our body. And chronic, usually it is due to some intrinsic factor. That means your own body's immunity is working against your skin cells. They are producing
Hmm.
various histamines, mast cell. They are breaking the muscle, and the histamine factors are getting released. We are getting temperature, we are getting swelling of the body, redness of the skin. All these factors are actually involved with the chronic type of urticaria. And after the test, you will not get anything which can precipitate, or for the cause of the urticaria cannot be known by the various tests because they are obsolete. They are of no use
Hmm.
in chronic urticaria actually.
Now, doctor, when a
And
patient
a
comes to
patient
you,
history is must. Patient
right,
history. It is a
right,
must. History
because
taking
I'm
of the
coming to
patient is
that.
must. Suppose the patient is telling that after doing the vigorous exercise, I am getting this. Then
Hmm.
you can be sure that this is a physical urticaria and this is due to this physical exercise.
Right.
Anybody can
So,
say that
history
when I am
taking
wearing
is a part of
dhaga,
diagnosis.
I am getting it.
Yeah.
So that is
Yes.
also one type of physical urticaria because they are wearing this dhaga very tightly,
Sure.
tight
Yeah.
belt, tight pants.
Hmm.
That can also cause it.
Okay. Right. So history taking becomes the part of diagnosis. That is how you
Part
comes
of,
to a conclusion, right?
moreover, there is one factor we have seen nowadays that many people I am seeing that we are now getting, they are not extracting the tooth. They are filling
Okay.
it with various metal. That metal,
Hmm.
after a few years, are getting percolated in the blood, and that is causing urticaria, mainly nickel. Nickel.
Ah, that's quite
Getting
common. Yeah.
teeth cover with nickel. That
Hmm.
can be a cause of the urticaria.
Okay. Right. Now, doctor, what are the treatment options for both acute and chronic urticaria?
See, main thing is antihistamines. No? So various types of antihistamines are now available, and you don't know what will be the actual thing. What we start with a minimal dose of the antihistaminics. Most of the antihistaminics can cause some sleepiness. Some
Hmm.
says it is better because when we can sleep, we will not itch
Hmm.
because there is a
Ah, right.
cycle: itch, and swelling, and more itching, more
Ah,
urticaria. There is a cycle type of thing. So if we get the sleep, then we will not scratch. So urticaria will not be there. That is one psychology. And
Right.
so the antihistaminics can cross the blood-brain barrier and cause some drowsiness. But nowadays, if you antihistaminics are available, that don't cross the
Hmm.
blood-brain barrier, and that will not cause any sleepiness, because most of us are now driving either car or cycle or
Yeah.
any two-wheelers. So
Hmm.
if the person drive a car and get sleepy, that will cause dangerous. So now
Right.
we are using that type of thing. Sometimes in case of acute cases, we are using steroids also, so that
Hmm.
patient can get relief immediately, because he or she may get some respiratory distress also.
Right.
Another types of medicines are there, but that we use it as per the
Hmm.
patient's severity of the urticaria, severity of the respiratory distress, etc. And then if we cannot control it with the minimal dose of the antihistamines, we just double the dose.
Okay.
After that, we can change the medicine. There are lots of medicines are there. Lots of medicines are now available.
Hmm. So, doctor, in case we find out the trigger, that what is triggering urticaria, it's easy to treat urticaria then in that patient by just avoiding the trigger factor. For
Yeah,
example,
yeah,
if tight clothes is
yeah,
causing
yeah, yeah.
urticaria,
Is it?
avoid that, right?
Yeah, yeah. That can be done. But it is very
Hmm.
difficult, because suppose you are getting to one food bed, usually the patient who is getting prone to urticaria with not only one food. Usually we see after the test, we get many foods are there, many inhalants are there, which are triggering factor. So how many things will you omit? Suppose two or three you can omit. Suppose eight. So egg related anything, including uh, cakes with egg, that also should be
A,
omitted.
yeah. Hmm.
And the patient should be conscious that what type of things he or she is eating should not contain any egg material.
Hmm.
Suppose milk, allergic to milk. So
Hmm.
milk and milk products will be omitted from the food. So milk
Right.
related lots of things are there, including the mithai, including the sweets.
Ah. Hmm. Right. So it becomes difficult many a times.
Yeah, very, very difficult.
A very
Very
common
difficult.
question people often ask, even our viewers are asking, do chronic urticaria gets cured or treated ever? Permanently cure is there for chronic urticaria?
No, there is no permanent cure, but it can be under control. And when
Hmm.
it is under control, then you can diminish the doses, and sometimes we can see that we can reduce and omit the doses also. And if it happens afterwards, if he or she can remove the triggering factors, then
Hmm.
it can be done. But the
Okay.
allergic thing which is inside, that we cannot treat completely. It is absolutely not possible,
Hmm. Right.
because it is an
Tina Bharga, one of,
autoimmune disease like thyroid or
right.
vitiligo.
Hmm.
When it will come again, you don't
Right.
know. You can't ensure the patient that I am fully
Ah.
curing it. You can get relief.
Hmm.
Definitely, we can get relief.
You're right. Doctor, one of our viewer, Tina Bhargav, is here, and her question is: can urticaria go by its own?
Urticaria, go by
Can
its own.
urticaria go by on its own? Yes.
Yeah, definitely it can go.
Okay.
I always ask the patient to just modify his lifestyle. How? I ask my patient to modify his lifestyle. Do some exercise, take some chia seeds, avoid fried foods, avoid एकदम cool water or cold foods. Hmm. to maintain the proper lifestyle, no fried food, all this can stabilize the immunity. So that can do it. In this way, if
Right.
we can modify the immunity, main factor is immunity. There is a aberration of
Hmm.
memory of immunity. Immunity
Okay.
is there, but there is
Hmm.
aberration of memory of immunity. There is a memory of the immunity also that
Okay.
is damaged. So that we have to make it settle. What the steroid is doing actually, it is making the immunity reduced. We may not use it. When we can use it, we can use it only in case of when other drugs are not effective. Then only we can use it.
Hmm.
Or there is a life-saving drug. When the patient life is in question, there is severe respiratory distress with urticaria, then we can use it.
Okay.
Other drugs are also there.
Hmm. Okay. Now, doctor, many a times people complain that their hives or urticaria get worse during night.
Yeah. Why? You
Yeah,
see, whole
why?
day we are working, we are busy. We forget about our skin.
Okay.
And when we're going to
Okay.
sleep, we start scratching. Sometimes you will say
Huh.
lots of patients are coming. They are telling that after coming back from the office or school or whatever maybe, we are coming back from duty, we are coming in the house, and after sitting there, we start scratching because they just
Hmm.
forgot that the the memory or forgot that there is a one disease called urticaria, and whenever he or she
Right.
comes back to home, then it again starts it.
Right. Right. So because
All
we
is
are
immunity and
preoccupied
memory of the
with
immunity.
right. It's all in the mind,
All in
right?
mind. All in mind.
Okay, doctor. Patients also compare that they feel very fatigued or tired when they have urticaria. Any reason for that, doctor?
As because na, it downs the life quality index.
Ah,
Suppose we
okay.
were talking with you or I am talking with you and I am getting scratched. So I'll be
Ah,
tired of this teaching, tired, mentally tired. Moreover, the various
hmm.
antihistamine factors they come to work. There may be skin temperature may be high. All the things are come to play.
Okay.
Other inflammatory
Right.
agents start working. There is redness. That means
Hmm.
there is inflammation of the skin, not only skin, inflammation also inside. Because skin is the largest organ of the body. So the same thing is happening also
Hmm.
inside. Skin is the mirror of the any disease. Skin is the mirror. It will tell you
True.
that what is happening inside also.
Hmm. Right. Now, doctor, is there any dietary precautions or do's and don'ts for the patients of urticaria?
I ask my patient to see whether he or she is getting any exacerbation of the disease after taking any food. If
Hmm.
not, I ask them there is no restriction of food. Usually ask them don't take very hot food or very cold something cold water, very hot food, hot tea. It should be avoided as far as possible, and just avoid the eggs and vegan like thing. That's enough. You can avoid
Okay.
prawn also. Prawn solely is not
Hmm.
responsibility because we are now giving various types of injection within the prawn to increase the weight of the prawn. That is
Okay.
another cause. We are giving various types of coatings on the apple. So apple is not the cause. The coating which we are giving
Ah,
that
right.
is destroying the man's immunity, and this is the cause of increased rate of carcinomas,
True.
increased rate of cancer
Unfortunately.
in man and woman.
Hmm.
That is also a cause. Lots of
Hmm.
chemical
Definitely.
insecticides, lots of chemicals we are using to ripe the mangoes. All these things are responsible for urticaria as well as cancer.
Right. Completely agree to that, doctor. Now, doctor, because we are talking about urticaria and we are getting so many questions from our viewers. One question from Amit Jadhav I'll take. Can insect bites or stings cause urticaria?
Definitely, that can also cause. Insect bite can
Okay.
cause two types of things. One is allergic disease, or
Mm.
another is irritant dermatitis. Irritant dermatitis is only located to that area where the insect bite has occurred. And if it is allergic to the bite or the poison which we get from in our skin from that insect, that can cause urticaria to any part of the body. That can also
Okay.
cause respiratory distress also due
Mm.
to pulling of the respiratory pathway.
Ah,
Usually
okay.
the bee can create this type of thing because that will make your respiratory pathway very narrow. So there will be respiratory
Ah,
distress with urticaria.
ah.
This is the cause.
Mm.
So there are
Like,
two types of things. There may be some irritant contact dermatitis which is located only to that part where the sting occurred, or it may be allergic. Allergic means it can create this type of disease to anywhere, any part of the body except not only to that sting area.
right.
Recently, probably we
Doctor,
have got something. We have seen that some person
yes.
died. I don't want to tell the name. Probably bee sting while he was playing golf.
Yes, yes. There was this recent case of a very celebrity
Yeah, yeah, that
businessman
that
who
was
was playing polo, and he accidentally swallowed a honeybee, and that
and
caused
that
anaphylactic shock, and he passed away. Very unfortunate, but then we need to be very careful.
yeah
Right. Now, doctor, many times we have seen, people who consume a lot of street foods, because a lot of coloring agent is there, then
yeah
sauce,
they
etc.
they
They
create
also get
all type of things,
urticaria.
including not only allergy, they can create cancer also, na?
Right, that is
What I
true.
told you that because of these additive agents,
Hmm.
already they are not only carcinogenic, they are also allergenic,
Hmm.
allergogenic. Now the various types of shampoos are available. There are various types of oils which we are using that may cause allergies.
Right.
Lots of ingredients are there, and we are using
Hmm.
it without consulting anyone
Right.
because of the advertisement.
True. A lot
So
of market gimmick is there. Hmm.
yeah,
Now, doctor,
the street food, maybe the
post
chowming, they are
COVID.
using some
Yes.
Ajinomoto. You know the Ajinomoto.
Yes.
They are
Yes.
using in the chowming. So that is absolutely
To
carcinogenic.
enhance the taste.
But only using it, and we are
Hmm.
consuming it also because it
Right.
increases the taste of the chowming.
Uh,
I don't know whether
right.
the big restaurants are using it or not, because
I have
that's
seen
not my
many
job.
restaurants who have these big boards outside their, outlets stating that we do not use Ajinomoto. I have seen many big restaurants doing that, but
Yeah,
then
many
we
big
don't
restaurants they are
know
using it,
because, we are
but you
getting
can't
from many places.
you can't discuss that with any other because
Right,
you know
right,
na.
completely. Doctor, post COVID also, we have seen a lot of cases of urticaria. Those who were the patients of COVID, they also, is there a relation between bacterial infection or viral infection with urticaria?
Yeah, because post COVID, actually this COVID as well as the vaccination of COVID, it has changed
Yes.
the scenario of immunity. Lots
Hmm.
of immune related diseases are now present, like alopecia areata, increased cases of vitiligo, increased cases of urticaria, all these type of patients we are finding lots of cases because of change of
Hmm.
immunity. What change of immunity? Change of memory of the immunity, aberration of memory. That is the main cause. Hmm. COVID, not only COVID,
Another
lots of
viewer,
viral diseases
Tanishka.
are there. Na? Lots of
Yes,
viral disease.
yes.
Any viral disease
There
can
is
change the scenario.
right. There is one more viewer with us, Tanishka Rajoria. Her question is: are there perfumes and clothes that I need to avoid for urticaria? Perfumes and clothes can
Okay.
also cause urticaria.
Yeah, definitely. Perfumes, clothes, tight clothing. Hmm. We always ask the patient to wear loose clothes, loose cotton clothes as far as
Hmm.
possible.
Right.
No tight
Okay.
clothing, no artificial things as far as possible. Because that will also trigger this type of urticaria.
Doctor, before we sum up the whole session, any take home message for our viewers who are watching this session? What to do, what not to do in case of urticaria?
Yeah. Clear. Do's and don'ts mainly you should you everybody should use something, some soap. Every day a soap should be used with your pH value of 5.5. Okay. The pH value of the soap will be 5.5.
Hmm.
Should wash her his or her clothes and undergarments regularly. Iron the undergarments regularly, mainly from the inside. As far as possible, as far as possible, avoid the detergent soap. Don't use any coloring material on skin or hair. Don't bleach your skin. Wear loose cotton clothes. Don't use any nickel or artificial things because that also can cause these things. Brush your teeth regularly twice at least.
Hmm.
No gutka, no tobacco, no to tobacco,
Hmm.
and no to any coloring material, no to any additive drinks. Various types of preservative drinks are now available. You know that.
Right.
That also can cause urticaria or trigger the urticarial factors. So it should
Hmm.
not be done. Just maintain your normal routine, exercise regularly, and take healthy food.
Right. Simplicity is the best policy of a healthy life.
Yeah.
So stay.
Simplicity is the best thing.
Yes. So
Simplicity and
keep
exercise.
yeah. So keep your food healthy, basic, minimalistic. Keep your clothes airy, cotton, clean. Keep yourself healthy. Adopt a good lifestyle. That goes a
And
long way.
iron the
Thank you.
undergarment is very important.
Yes, that is very important, especially from
From the
inside out.
inside, not only
Yes,
outside, from the inside. The inside thing contains all the hazardous things.
right.
Very important. It should
Thank
be
you
done
so very
regularly.
much.
Thank
Definitely, doctor.
you.
Thank you so very much for
Thank you.
joining us, for your valuable time, and making this session so informative and interesting. Thank you, doctor.
Thank you.
And viewers, thank you for your excellent participation. For more updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great evening ahead.